Hello, what seems to be the problem today?
Hi, my puppy, he's 2 months old, and I've been noticing his hair falling out, and he has a lot of bald spots.
Okay, so has he been acting normally and eating well?
Yeah, he's been eating a lot.
Okay, so I'm gonna need to review his medical history and do a thorough physical exam, and I'll probably need to take some blood samples for some further testing.
Okay.
Okay, so I'm seeing symmetrical hair loss on his trunk, neck, ears, tail, and thighs. There's even some total baldness on his torso. I can also see that his skin has turned black in the areas where his hair has been lost, and I'm really only seeing hair growth on his face and legs. So you said he was 2 months old, right?
Yes.
Okay, as a 2-month-old purebred German Shepherd, he should be a lot bigger than this. So with that in combination with the other symptoms, I would assume that this is pituitary dwarfism. However, before I can confirm anything, I will need to do some testing with a blood sample.
Okay.
So I'm going to test for his levels of growth hormone and his other hormones. I'm also going to do an insulin response test for his normal adrenal gland function, and take some skin samples to be analyzed.
Okay, sounds good.
Okay, so I tested his levels of growth hormone, and I'm afraid that your dog does actually have pituitary dwarfism.
So what exactly does that mean?
So this isn't a disease that your dog caught somewhere. This is hereditary, so he got it passed down from his parents. But they probably weren't expressing any of the symptoms because it's a recessive trait. So what this means for him is that we won't be able to cure it completely, and we don't even know how much we can do because it's a malfunction in his genes. However, there are some few treatment options if you want to hear them.
I would like to hear.
So we can give him some synthetic human growth hormone. However, that's very expensive and difficult to obtain. And if it doesn't start working around 4 to 6 weeks, probably nothing will happen. In addition, I'm afraid because growth hormone affects so much of the muscle movement and growth of the body, your dog's lifespan will be shortened.
But if I do the growth hormone treatment, will that at least extend it a little bit?
It should extend it a little bit, but again, we can't promise the effectiveness.
Okay, so I think we'll go ahead and try the growth hormone and see if that works.
Okay, great.
Thank you.
Pituitary dwarfism is the result of inadequate production of growth hormone by the pituitary gland. The lack of production of growth hormone may be due to an underdeveloped pituitary gland, cysts within the gland, infectious diseases which affect the gland, or tumors. Growth hormone has many effects within the body, including controlling the growth rate, maintaining the hair coat, and facilitating bone and teeth development.
Causes. Canine pituitary dwarfism syndrome is often inherited. Breeds prone to the syndrome include the German Shepherd and the Carnelian Bear Dog. The trait exists on a recessive gene, so an affected puppy must have inherited one deformed gene from each parent. When two of these defective genes appear in the same puppy, pituitary dwarfism occurs. Pituitary dwarfism in dogs can also occur when the pituitary gland fails to develop normally. Cysts, tumors, and other growths in the pituitary gland can also cause underproduction of growth hormone.
His permanent teeth may come in late or may never come in at all. Dogs with pituitary dwarfism syndrome are often sterile. Females may never come into heat, and males may have small testicles or undescended testicles throughout their lives.
Diagnosing canine pituitary dwarfism. There are a number of tests that can be done to confirm the diagnosis, including blood tests, urinalysis, and biochemical profiles. The levels of growth hormone in the dog's blood will be tested to verify the lack of growth hormone. In addition, the levels of the dog's other hormones will be tested to ensure that further endocrine problems haven't occurred. Problems with the thyroid and adrenal glands, which also make up the endocrine system, are common in dogs with reduced pituitary function.
Treatment. Multiple injections of growth hormone can be given several times a week for some months. However, this treatment is very expensive and not always effective. In addition, there's the option of thyroid hormone replacement therapy if the thyroid gland has ceased to function or is functioning improperly. Cortisone replacement therapy may also be necessary if the adrenal gland has been compromised. Finally, once the dog reaches sexual maturity, it is a good idea to get him neutered. Pituitary dwarfism syndrome in dogs is usually hereditary, and dogs who suffer from it should not be bred. Unfortunately, since so many organs are affected by a lack of growth hormone, normal lifespans are not to be expected.
Problems with treatment. Unfortunately, effective treatment of pituitary dwarfism is not possible in dogs. Canine growth hormone is not yet available for use as a therapy, and only porcine or human growth hormone has been tried. Because of the differences between canine and human growth hormone, the formation of antibodies against the human growth hormone is common in dogs, making this treatment ineffective. Porcine growth hormone appears to work better, but it is expensive and not widely available. The outlook for dogs with pituitary dwarfism is poor if treatment is not attempted. By 3 to 5 years of age, affected dogs are usually bald, thin, mentally dull, and lethargic. These changes are due to the progressive loss of pituitary function, as well as the continuing expansion of the pituitary cyst. In canine pituitary dwarfism, there is not enough growth hormone released from the pituitary gland. This diagram demonstrates how the release of growth hormone should occur in a healthy dog. First, GHRH and somatostatin are released from the hypothalamus and travel through the primary capillary plexus to a somatotrophic cell. In the somatotrophic cell, GHRH will bind to a GHRH receptor with a G protein. G-alpha will be released from the G protein coupled receptor and bind to adenylyl cyclase. The G-alpha stimulates adenylyl cyclase to convert ATP to cyclic AMP. The cyclic AMP will then activate protein kinase A. Protein kinase A will activate a calcium channel and calcium will flow into the cell. This will cause a release of growth hormone, or GH, from the somatotrophic cell. The GH will then travel through the secondary capillary plexus and exit the anterior pituitary gland. At the same time, somatostatin will bind a somatostatin receptor with the G protein. The G-alpha will be released and will travel to adenylyl cyclase where it inhibits the release of GH. Because GH is being released from the somatotrophic cell, there are more GHRH receptors than somatostatin receptors on this cell, so the release of GH is not inhibited.
This diagram shows a simplified version of how growth hormone is released and its effects. First, GHRH and somatostatin are released from the hypothalamus. They will then travel down to the pituitary gland. Inside the pituitary gland, GHRH stimulates the production of growth hormone, while somatostatin works to inhibit it. At this particular point, since growth hormone is being released, there is more GHRH being released than somatostatin. When growth hormone is released from the pituitary gland, it travels to the liver and other tissues, where it is converted into IGH1. The importance of this diagram is the feedback loops that are demonstrated. The release of GH has a negative feedback on itself, meaning that the more growth hormone that is present in the blood, the less growth hormone the pituitary gland will release. GH and IGH1 have a positive feedback on the release of somatostatin. Thus, the more GH and IGH1 that are present in the bloodstream, the more somatostatin that is released. So the production of growth hormone and subsequently IGH1 will be inhibited. When applying this diagram to a dog with pituitary dwarfism, the amount of growth hormone being released from the pituitary gland is not adequate for a dog to grow and function normally. During treatment, human growth hormone or porcine growth hormone is added in place of the canine GH, in the hope of inducing the cycle to resume normal function.